Itchy, scratchy, desert dry, teary, trashy, crusty sty. Sticky, burning, makes you cry. You rub and rub and rub your eye.
Blepharitis, the most common eye disease in the world, and until recently, the most undertreated eye disease in the world. Blepharitis is the precursor of most lid diseases such as dry eye disease, contact lens intolerance, and meibomian gland dysfunction, also known as MGD. Now let's go back and look at those eyelids again. Blepharitis is an overgrowth of otherwise normal bacteria living along the margins of the eyelids and lashes. This is the only place on the body that never gets washed your entire life. So over time, these bacteria build up and form a biofilm, like the plaque that forms on your teeth. This toxic environment makes for a perfect food source for a nasty little mite called Demodex. He makes the irritation and inflammation of the eyelids even worse. These biofilm bacteria begin to produce substances called exotoxins. These exotoxins cause the tear glands within the eyelid margin to become inflamed, which degrades the quantity and quality of the tear. Our tears contain our natural antibodies, so fewer tears results in even more bacteria in the biofilm, and a vicious cycle is established, leading to malfunction of the meibomian and aqueous tear glands, the glands most responsible for good tear production. Symptoms of blepharitis range from mild to severe and include foreign body sensation, irritated watery eyes, itching, crusting, eyes stuck together in the morning, grittiness, and the need to constantly rub the eyes. As the vicious cycle continues, the disease slowly progresses, eventually leading to dry eye syndrome. Historically, the only treatment for blepharitis has been scrubbing your eyelids at home with baby shampoo or other product. This treatment has never proved very effective, nor has it been accepted well by patients because home scrubbing cannot remove the biofilm. Prescription eye drops are equally ineffective since they also do not remove the biofilm, and they can be very expensive, which leaves only one temporary solution available: lots of artificial tears. This is not a good solution to the problem. Now, eye doctors have a way to break the vicious cycle of blepharitis and bring relief to millions of patients who suffer daily from this disease. Introducing Blephex, a revolution in the treatment of blepharitis and dry eye. The biofilm full of exotoxins that has been building up for years is now safely and effectively eliminated, removing the source of inflammation as well as the food source for Demodex. The procedure takes just a few minutes and is well tolerated. Most patients report an improvement in symptoms almost immediately, and many begin to make more of their own tears again. Blephex needs to be repeated at regular intervals to keep the disease from returning, much like going to the dentist and getting your teeth cleaned. By keeping your eyelids in optimal health, you should be able to keep free of blepharitis and keep your tear glands healthy and active for the rest of your life. Blephex is not covered by insurance, but you will find the procedure to be very affordable, especially when compared to the hundreds of dollars spent every year on ineffective prescription drugs and artificial tears. Be sure to ask your eye doctor if you might be suffering from blepharitis and if Blephex might be right for you. Relief is finally here, so give your eyes a rest with Blephex.